Thank you very much for a nice introduction. Good afternoon, everybody. Ladies and gentlemen, now I will share my simple research related to HIV-related stigmatized attitude among healthcare workers in Aceh, Indonesia. Aceh is one of province in Indonesia which is implement Sharia Islam or Islamic law only in Aceh, and also with very low HIV case loading. As we know that stigma and discrimination has a very close relationship, because stigma can cause discrimination, which lead violence of human rights. So we have to stop this cycle to stop violence of human rights. To stop this, we should know the causes of HIV or AIDS-related stigma or stigmatized attitude. So it's very hard causes that we can find in population. Therefore, we should know or we should understand to stop or to eliminate HIV-related stigma in our population, especially in healthcare worker, because healthcare worker is very important to serve people living with HIV in clinical setting. So, as we know that stigma toward people living with HIV is major barrier in assessing treatment, also care, and also in HIV prevention, and also in education and information sharing among people living with HIV, and also general population to people living with HIV. Because of stigma, this stigma is major barrier, so we should decrease this stigma, because if the stigmatized attitude is very high, so it can cause a hidden epidemic in our population. So therefore, as one province in Indonesia with very rapidly high number of increasing number of HIV patients, so we need to know what happened in Aceh, especially because this province implements Sharia or Islamic law in Indonesia. If we see here, Aceh is located in Sumatra Island. So this I did this study in a sick location, which is the red dot right there. So what is our situation? So Aceh has population about 4.5 million people, but total HIV in 2016 only 98, and total HIV patient only 130. So it's very low number of HIV. Therefore, we should know. But this is the problem is because in 2009, the number of people living with HIV in Aceh only 29, but in 2013 it's increasing very rapidly. So we should know what happened in Aceh. Therefore, we should know there might be a stigmatized attitude that exists in Aceh. The main objective of this research is to understand the reason, or maybe the cause, or the factors that might be influence the stigmatized attitude among toward people living with HIV among healthcare workers in Aceh. There are several independent variables that we look at. For example, knowledge of transmission of and also prevention of HIV, irrational fear, value-driven stigma, facility profile of a hospital, for example, and also social economic factors, a length of a time of working, having a direct contact with people who living with HIV, and also number of HIV/AIDS related training that healthcare workers receive, and also a type of healthcare worker provider or healthcare worker in hospital. So, in short, that this study is cross-sectional study with a face-by-face interview with guiding by questionnaire. The questionnaire is actually have published in a previous publication that is already validated in several publications, but we revalidate in our sample or in our respondent. So this is our statistical analysis. So, and we use one-way analysis of variance or ANOVA, and also correlation coefficient. And we did a multi-linear regression model in the end. What we found that, but actually is we interview about 589 healthcare provider or healthcare worker that are doctors, nurses, midwife, and also supporting staff. And a third of healthcare worker are female, and as we predicted, almost 98% they were Muslim, because based on our data, 99% of our population was Muslim. And here we can see that only about 40% of healthcare worker in Aceh that had directly contact with people who living with HIV, but about 70 or 60% they never have direct contact with people who living with HIV or HIV patient. This is independent variables that might be, some of them have correlation with stigmatized attitude, especially knowledge of transmission on and prevention of HIV, value-driven stigma, and overestimated risk. But knowledge on transmission and prevention of HIV has a negative correlation with stigmatized attitude. It means if the healthcare worker have high or good knowledge on transmission or prevention of HIV, the stigmatized attitude will be decreased. This is our model, full model. We found that location and also religion have independent factors, but actually it's not fair, because the religion, only 2% of our sample or our respondent are non-Muslim. So it might be something wrong here if we include religion as a factors. But maybe in the future we can compare, for example, between two regions that had majority with Muslim and non-Muslim. We can compare what happened if the religion is independent factor or not. I think Muslim or Islam with non or other religions, I think, have the same law actually. But in our reduced model, we found that only value-driven stigma and overestimated risk that has correlation with stigmatized attitude among healthcare workers in Aceh. As conclusion, this is a simple conclusion that stigmatized attitude have negative association with direct contact. So it means if someone having direct contact with people living with HIV, so their stigmatized attitude will be decreased. And also good knowledge on transmission and prevention of HIV is very important. Therefore, in the future, I think to reduce the stigmatized attitude among healthcare workers in Aceh or in other province in Indonesia, we should increase the knowledge of transmission, the knowledge on transmission and prevention of healthcare workers, because it's very important. Because some of them or some of our healthcare workers has irrational fear to HIV contact. So they avoid HIV patient coming to their hospital, or they didn't give service, medical service, because of their fear. And also value-driven stigma and overestimated risk. Overestimated risk it's quite the same with irrational risk, that is very can increase the stigmatized attitude among healthcare workers in Aceh. I think this is a very simple research. Thank you very much.
Thanks, Dr. Harapan.